Good morning, everyone, and welcome back to this edition of Bringing Out the Ed. My name is Jonathan Barr, aka MD4 with Cooper Medical Command, and this time we'll be tackling the topic of child abuse. I do want to warn our viewers here that I do have some graphic images of injuries that were secondary to abuse during this presentation. So if you find those images upsetting or disturbing, I advise that you tune out. I'll give you another warning right before those images come up. Now, child abuse is a tough situation because this situation occurs right at the intersection of medical care and law enforcement, and so as EMS providers, it requires you to really be knowledgeable about this and to be at the top of your game, because these are often very challenging situations, both in terms of the injuries and also in terms of managing the social situation and the scene. So what are we going to do today? We'll first start by looking at how to recognize the signs of abuse. What are the most important things for you to get done in the field? And then also, importantly, we'll talk about how to report child abuse. First, let's talk about how to recognize it. So in order to recognize it, you need to know what it is. And so child abuse or maltreatment is anything that results in the harm, potential harm, or threat of harm to a child. So these acts can fall into two categories: things that people do, or acts of commission like sexual abuse, physical abuse, or emotional abuse, or they could be things that people don't do, or acts of omission. And this could be things like failure to provide medical or dental care for a child, or failure to send the child to school as educational neglect. It can also be failure to supervise. So if there's not good supervision of the child, or if the child is regularly exposed to violent environments, those could fall under abuse as well. And so who does it happen to? Who is at risk for this? So usually this is a combination of factors related to the child, the parent, and the environment or surrounding social circumstances. So children who have chronic illnesses, physical disabilities, or developmental disabilities are often at increased risk of being abused. Children who are quote-unquote unwanted or who were born prematurely also have increased risk. Parents who have low self-esteem, who are abusing substances, who may have mental illness such as depression or other mental illnesses, who were abused as children themselves, young maternal or paternal age, as well as poor knowledge of child development can lead to increased risk of abuse. And then the environmental factors such as social isolation, unemployment, lower education level, or financial strain, single parenthood, or having a non-biological male living in the house, intimate partner violence, all those things increase the risk that child abuse can occur. So we talked about the definition, we talked about the factors that make child abuse more likely or make the patient more at risk for it. What are some of the clues you can get on history? So it's really important to get a good history. Sometimes if you find inconsistencies between the caregivers and bystanders who are reporting the events or other individuals, that could be a tip-off. Other things is that the injuries might not make sense with the events, so that's really important. Caregiver apathy or overreaction about the events, and injuries not consistent with the developmental ability, and that's really important. And we'll talk a little bit more about injuries that would be inconsistent with that. And if the child is able to speak, then if they're prevented from doing so, that could be a potential sign that something more is going on. So let's look at what clues you can find on physical exam. So one clue might be bruises in varying stages, as you see here. The pattern of bruise, in addition to the stage, also matters. So this diagram here illustrates some common bruising patterns from regular injuries, such as playground injuries, things like that. But this diagram shows the more concerning pattern of injuries following a 10-4 pattern, and that's not 10-4 like the 10 code to mean okay or acknowledge. This is not okay. So if you see bruising patterns on the torso, in the ears, face, neck, in this pattern here, that's really important. And the 4 stands for age less than 4 months. And one way to help remember the age is that kids who don't cruise rarely bruise. That's a helpful mnemonic. And so at younger than 4 months, they shouldn't really be walking or moving around too much, so they really shouldn't be bumping into things and getting bruises. Now, in some children, it may take up to 9 months for them to be moving around, and so you should also consider children less than 9 months at potential risk if they have a lot of bruises. So non-ambulatory pre-cruisers should not really have bruising, and so if you see bruising in this population, that could be a sign for concern. Now, what the shape of the bruise looks like could also be a tip-off. So these are common patterns from various objects, and so if you see bruising or injury patterns that match the shape of these, that could be a sign of abuse. Now, I mentioned at the beginning I did have some graphic images. I'm about to show those, so if those images may be concerning to you and upsetting to you, and you wish to tune out, please do so now. So this injury here, you can see it's very circumferential, well circumscribed. This is a cigarette burn type injury. Now here's another abuse pattern of burn injury. Now injuries due to burns that were spontaneous usually have like a splatter pattern from liquid splashing, things like that. You can see this injury actually has well demarcated lines, and you see also the distribution of the perineal area implies like a dunking or kind of submersion injury like that. And you also see well demarcated. That is more consistent with a burn that was created intentionally. And you could see that again here. So you see these well circumscribed lines, well cut off point. The burns to the dorsal surface like this here, and sparing of the plantar surface or palmar surface are also concerning for possible abuse pattern. What about this guy? So a little more subtle, but remember that 10-4? Okay, see this pattern here on the face here? That's a bruise that's suggestive of abuse pattern. And we talked about that the injury could take the shape of objects. You could see here will look like grill marks or marks from a hot grate. What about this one? Take a look here, see what you see. Remember that 10-4 pattern? Remember the E for ears? Take a look right there. Right, so sometimes it can be a little more subtle. It's not as pronounced, I think, in this image compared to the others. So you really want to look at those subtle findings and do a really good physical exam. Make sure you check the ears. Now, some other clues on physical exam would be age-inappropriate behavior, such as a child making inappropriate sexual gestures, inappropriate for their age. Also look, do they seem to have injuries or infections that have kind of been festering or sitting for a long time and unaddressed? Any genital trauma is concerning in a child. Do they look like they're malnourished? Do they look emaciated? Do they have poor dentition? Are they not getting follow-up on their dental care? And any child who has altered mental status, that makes you worry about a head injury and intracranial injury, which could be secondary to abuse. So what's important for you to do in the field about this? First, if the scene was unsafe for the child, it may also be unsafe for you. So make sure you're really watching out for hazards on scene to yourself and to others, and make sure the scene is safe. Second, you're going to want to treat any life threats, and you want to get the patient out of that abusive environment. If this is what you are concerned is going on, you really want to get them out of there and get them to the hospital. You do not need to stay on scene and conduct a thorough investigation of what happened. You need to treat immediate life threats and get the patient to a hospital. Now, let's talk a little bit about reporting of child abuse. You have to report this whenever you have any concern about it. Even the slightest concern, you must report. You're a mandated reporter as an EMS provider, so you have to do this. If you do not do this, there are penalties, as you can see, fines up to $1,000 or 6 months in prison. So as a mandated reporter, you have to do this. And if you do this, you're protected. So if you make a good faith report of child abuse or neglect, you're immune from any criminal or civil liability if you made this in good faith. And that's really important to know that. So not only do you have to report, you're also protected if you do report. Now, you might want to know what information do I need for the report, or what information is helpful? So like I said, if the scene's unsafe, you might need to treat and load and go, but the more information you can get, the better. This information is going to be helpful for reporting. So you need to know who the child is and who the parents are, and also who the suspected abuser is. If you can get their demographics, that's helpful. You're going to note the things that made you concerned for the abuse. What did you see that made you concerned? You need to you want to know when the events happened and when you learned of them. So if you think they happened a while ago, note that. Note the location of the incident and whether the suspected abuser still has access to the child or victim. And they might ask you for your assessment of how urgent it is, how much threat there is, how dangerous it is in the current environment. Now, how do you do it? I'm going to pause here. For those providers in New Jersey, write this number down, put it in your phone, save it. This is the number you need to call to make a report about child abuse. So take it down right now, put it in your phone, and have this number handy, because this is the number you'll need when you next time this happens and you have to make a report. Now, one thing that's confusing that I hear is people say, oh, well, I told the charge nurse at the ED and they're going to make the report. Or, oh, I told the police officer, or I told my supervisor or my EMS chief. That is not sufficient. Again, that is not sufficient to satisfy your requirement. You have to call as the EMS provider if you were on that scene. So your crew needs to make this phone call and make the report. That being said, it's a good idea to tell the charge nurse and tell the police officer that you're concerned about this, but you do have to call yourself, and I want to emphasize that. So let's summarize it up. So abuse can be acts of commission or omission. It can be physical, sexual, or emotional, or it could just be neglect, such as failing to provide medical or dental care, or failing to supervise. Anyone can be a victim of abuse, but there are certain risk factors that we talked about. Keep an eye out for concerning circumstances on the scenes you're in. Remember, you might be the best eyes and ears for this as you're going into the patient's house. Do a careful physical exam and look for subtle findings. And if you have any concern about abuse, any concern, you should make a report. You don't need proof. You don't need to conduct an investigation. All you have to do is have any concern, then call that number, make a report, and they'll investigate from there. Also, get the patient out of the environment to the hospital if you can. Thank you guys for listening in. Stay safe out there.